It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following: 7 common puppy diseases and how to protect them. Here's what you need to know about the most common puppy illnesses and how you can help your newest family member. 1. Parvovirus, Parvo. Parvovirus is one of the scariest diseases a puppy can get. It's easily transmissible and life-threatening. It is transmitted through feces and can survive in the environment for months or even years. For this reason, it is recommended to avoid leaving the puppy on the ground in public places or taking it for a walk in the neighborhood until it is fully vaccinated. Parvovirus symptoms can progress rapidly. If you notice any of these common symptoms, contact your vet. Vomiting. Diarrhea, usually bloody and profuse. Lethargy. Decreased appetite. Depression. Dehydration. Stomachache. Pale gums. Fever. Weakness. Seizures. There is no specific treatment for parvovirus, only supportive care. Ideally, puppies with parvo should be hospitalized to ensure they receive proper care. 2. Distemper. The distemper virus is another highly contagious and deadly virus that primarily attacks the respiratory, gastrointestinal, and nervous systems of dogs and puppies. The virus is usually spread through the air, such as by sneezing or coughing, or by sharing bowls of food and water. The symptoms of distemper are the following: green or yellow discharge from the eyes, green or yellow nasal discharge, fever, cough, lethargy, decreased appetite, vomiting, thickened pads, spin around, nod, seizures. As with parvo, there is no treatment for the distemper virus. Supportive care can be provided for your pet, but the disease is often fatal. 3. Kennel cough. Kennel cough, more formally known as canine infectious respiratory disease, is one of the most common upper respiratory illnesses in both dogs and puppies. It can be caused by bacteria or viruses, or both. Kennel cough is transmitted when your pup's mouth or nose comes in contact with the disease. That's why the common puppy disease is associated with places that have a lot of dog traffic, such as kennels, shelters, grooming facilities, dog parks, and veterinary hospitals. Kennel cough is easy to recognize. Your dog will cough but otherwise appears healthy. He will eat well, drink well, and have good energy, although he might also experience some runny nose or eyes. 4. Leptospirosis. It is a bacterial infection that is usually transmitted through infected urine. Dogs contract it by being exposed to water sources, soil, food, or bedding that has infected urine on it. Once infected, the bacteria primarily make their way to the kidneys and liver. Dogs that are more exposed to livestock and wildlife, as well as dogs in a shelter, appear to be at higher risk of contracting the disease. This disease can be transmitted to people. For this reason, it's important to wear gloves and wash your hands when cleaning up your dog's urine until you've finished his treatment. Leptospirosis can be fatal and some dogs require more aggressive fluid therapies. Even after surviving the initial infection, dogs can develop chronic kidney failure and chronic liver disease. 5. Vomiting and diarrhea. Although they are not illnesses in themselves, vomiting and diarrhea are symptoms of an underlying illness. Treatment for vomiting and diarrhea varies depending on the cause and can range from outpatient therapy to surgery, and perhaps hospitalization. 6. Parasites. Parasites are organisms that live on or in a host and obtain their food from or at the host's expense. Puppies are more prone to parasites due to their underdeveloped immune systems, and there are several different types of parasites that can affect them, both externally and internally. Internal parasites, the following: intestinal worms, hookworms, UHAD, whipworms, Giardiana, coccidia, heartworms. The following external parasites: fleas, ticks, lice, ear mites, scabies, sarcoptic mange, demodex, Calathea, walking dandruff, mites. Symptoms and treatment vary greatly depending on the type of parasite. 7. Adenoviruses. Canine adenovirus, also known as infectious canine hepatitis, is a viral infection in dogs. It is usually transmitted through contact with an infected animal. The virus mainly attacks the liver and the cells lining the blood vessels. Adenovirus symptoms the following: fever, decreased or lack of appetite, lethargy, depression, vomiting, diarrhea, usually bloody, cough, discharge from eyes and nose, weakness, difficult breathing. Like most viruses, there is no specific treatment for adenovirus, but supportive symptomatic. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.